Medicare open enrollment runs for exactly 7 weeks each year, October 15th to December 7th. If you make the wrong choice during that window, or miss a deadline you didn't know existed, you can be locked into paying hundreds of dollars more per month than necessary, permanently, not just for that year, for the rest of your life, because some Medicare penalties are permanent, they don't expire, they don't reset, they grow larger every year, and they follow you for as long as you have Medicare coverage. In this video, I'm going to walk you through 4 specific enrollment mistakes, the ones that appear most frequently and cost the most money. The 4th one is the one almost nobody knows about. In my view, it also has the largest long-term financial cost of the 4. This is information, not advice. Use it to ask better questions of a licensed Medicare counselor, your state health insurance assistance program, or Medicare.gov directly. Let's start with the window that most people misunderstand. When most people hear Medicare enrollment, they think of the annual open enrollment period in October. But that's not the first deadline that matters. The first one is your initial enrollment period. It opens 3 months before your 65th birthday, includes your birthday month, and closes 3 months after. That's a 7-month window to enroll in Medicare Part A and Part B. If you're turning 65 and you're not working with employer-sponsored health insurance that qualifies as primary coverage, that window is critical. There are exceptions. If you're still working and covered by your employer's health plan or your spouse's plan, you may qualify for a special enrollment period when that coverage ends. But the rules here are specific and easy to misread. The wrong assumption can still lead to penalties, which brings us to the first major mistake. Mistake 1, the Part B late enrollment penalty. If you don't enroll in Medicare Part B when you're first eligible, and you don't have qualifying employer coverage, you're charged a 10% premium increase for every 12-month period you were eligible but didn't sign up. That penalty is permanent. Enroll 2 years late, your Part B premium is 20% higher than it otherwise would be. For life. Enroll 3 years late, 30% higher. For life. The current base. Part B premium is around $185 per month. A 20% penalty adds $37 a month. That's $444 a year. Over 20 years, that's close to $9,000 in extra premiums, paid purely because of a missed deadline. Part D, the prescription drug coverage, has a similar penalty. 1% of the national base beneficiary premium for every month you were eligible but didn't enroll. Also permanent. Mistake 2, choosing between Medicare Advantage and Original Medicare without understanding how they actually differ. This is not a judgment about which plan is better. It depends entirely on your situation, but most people choose without understanding the core structural differences. Medicare Advantage is offered by private insurance companies. Most plans use networks, meaning your doctors and hospitals need to be in the plan's network, or your costs go up significantly. Many procedures require prior authorization, meaning the insurance company approves them before your doctor can perform them. Original Medicare, paired with a Medigap supplement plan, works differently. You can see any doctor in the country who accepts Medicare, which is the vast majority of physicians. There's no prior authorization process for most services. There's also an important distinction in how benefits are structured. Medicare Advantage plans are renewed annually. The network, the premiums, and the covered services can all change each year. Your Medigap supplement plan, once you've enrolled and been underwritten, stays with you with much more stability. This doesn't mean one is always better, but it means the decision deserves careful thought, not a default choice based on a television advertisement. Mistake 3, not knowing about the birthday rule. Several states have what's called a birthday rule. In these states, for a window around your birthday each year, typically the month of your birthday, sometimes longer, you have the right to switch from one Medigap supplement plan to another without going through medical underwriting. Medical underwriting means the insurance company can review your health history and potentially charge you more or deny you based on pre-existing conditions. Outside of your initial enrollment period and outside of states with birthday rules, switching Medigap plans often requires underwriting. If you're in a state with a birthday rule, that annual window is a real opportunity, particularly if your health has changed, if better plans have come onto the market, or if your current plan's premiums have increased significantly. Not everyone knows this window exists. Missing it means waiting another year. Mistake 4, and this is the one I want you to pay the most attention to. Most people choose their Medicare plan for where they live right now. But what happens if you move? Medicare Advantage plans are built on local provider networks. If you move to another state, or even to a different region within your state, your plan may not have a network there. You may face very limited coverage, or you may need to change plans entirely during a special enrollment period. And if your health has changed since you originally enrolled, re-enrolling may come with complications. For retirees who are relatively settled, this may not be a major factor. But for anyone who might move to be closer to family, to a retirement community, or to a warmer climate, this is the consideration that gets overlooked most often, and it can be the most expensive mistake of the 4. Original Medicare with a Medigap supplement travels with you. It works at any Medicare accepting provider in the country. If there's one question worth asking before you choose a plan type, it's this: where do I expect to live for the next 10 to 20 years? The good news is that comparing plans is free, accessible, and easier than it used to be. Medicare.gov has a plan finder tool that lets you enter your medications, your zip code, and your doctors to compare plan options in your area side by side. It's genuinely useful and doesn't require a credit card or a sales call. Your state also has a free counseling program called SHIP, the State Health Insurance Assistance Program. It's staffed by trained, unbiased counselors whose only job is to help you understand your Medicare options. No sales, no commission, completely free. If you want personalized guidance from a licensed Medicare advisor, someone who can walk through your specific situation in detail, I've linked a resource in the description below. It's a good option if you want to talk through the plan comparison process with someone who does this professionally. The deadlines in Medicare are real. The penalties are permanent. But none of this is complicated once you understand how the system is structured. You now have the framework. Use it. If you found this useful, the video right here on managing blood pressure after 60 pairs well with this one. Understanding your Medicare plan works best when you also understand the health conditions Medicare is most likely to be treating. That connection matters.